The need for speed is real. Provinces and cities are going to have to rapidly ramp up the vaccination process in order for 80% of Canadians to get one dose of a vaccine before the end of June, as the National Advisory Committee on Immunization claims is possible. And provinces like Ontario have made that a target. Is it possible? Well, the vaccines are coming now. How fast should cities open up given the rising threat of the variants of concern? So there's lots of questions facing the big cities. And to talk about those, we're joined now by the Mayor of Toronto, Mayor John Tory. Great to have you on the program, sir. Let me just start with this vaccine rollout as we're into the vaccine deluge now. When will these mass sites be open for people? And I know pharmacies are open, but these mass vaccination sites, and will you encourage them to be vaccinating 24/7?
Well, the encouraging thing is that we're already at 27 clinics, and we've had those going for some time. We've done 200 and some odd thousand inoculations already. But the answer to your question is we're ramping up, and three things have to happen or have happened. The registration system that allows people to schedule opened up on Friday and is open now over the weekend, and thousands of people have already signed up. Then early in the week, we get a shipment of vaccine, which is, of course, the one thing that has to happen. And then on Wednesday, we opened the first 3 of our mass immunization clinics. And we've had these 27 clinics going in hospitals and different places in the community before now, but the mass immunization clinics, of which there will be 9, and the other 6 are ready to go. But we're opening these first 3, and that will allow us to take bookings for, actually, over the next month, 133,000 registrations for people 80 plus, and we'll get on with putting needles in those arms, supply willing, on Wednesday.
Okay, so now the supply's coming, and the federal government's saying there's going to be ramping up of supplies because of that. Will you be able to vaccinate 24/7? Will any of the sites run like that?
Again, it's going to be totally dependent upon supply, because what we don't want to do is have, say, these 9 clinics and all the other ones. We're operating mobile clinics. We've got hospital-based clinics. We've got other community-based clinics. So right now in Toronto, there are already, including the pharmacies, about 300 places that are active. What we don't want to do is have a number of places operating 24/7 and then find that constrains the supply to somewhere else. So because you have to have supply on hand to accommodate for a 24/7 operation. So we've not ruled it out, but the task force that is advising us and helping us implement this has said that we will look at implementing a 24/7 or expanded hours if the supply is adequate to do so.
Are you worried about some confusion, clarity about the rollout strategy? One part of your city has something and someone else, and it's basically a patchwork strategy. Any concerns about that?
Well, the bigger concern in our case, and I'm sure it's true in some of the bigger cities across the country, is that you're in a region. And so in our case, we're in a region. So Toronto is, yes, the biggest city in the country and the sort of the biggest population center in the region. But there's like several other municipalities around us that have millions of people in them. And they're doing things different than we are because they're different municipalities. And so I think it's hard for people to keep up. And I fully understand that. There's not much we can do about that. I pulled the mayors together and the communications directors to try to at least compare announcements and share those things with each other in advance so that you don't get as many conflicting messages all happening at the same time. But it is challenging when you're in a big, region with millions of people, as is the case in, Montreal, Toronto, Vancouver, and some of the big cities around the country.
Mayor, there is massive pressure on mayors like you to open up. Businesses are suffering. It's been now over a year since the pandemic was declared, but yet the variants of concern are real. 40% of the new cases in your province of Ontario are these variants. How are you calibrating the reopening versus the risk of a third wave?
We're having what amounts to basically daily discussions that take into account not just the health numbers, which obviously are of preeminent importance, but also the psychology of the people, because that's important in terms of how they behave, regardless of what restrictions are on or not on. The region that I just talked about, because we can't operate as an island here. So right now, at this present time, there are areas around us that are in the same media market that are open, and people can easily drive to go shopping or go to a restaurant, which they couldn't do to the same extent. This week, thousands of new shops opened up in Toronto, but so there's that factor. And then finally, there's the economy itself, and you have to sort of try and do that balancing act we've been doing throughout the pandemic, which is, well, what is the benefit from a health standpoint of maintaining restrictions versus what is the cost to the employees and to the businesses and even to the mental health of people involved in business.
Vaccine targets. Do you think you'll be able to meet this June 20th? Because a lot of folks are saying, you hear Joe Biden, the president of the United States, saying, people are going to be able to have a backyard barbecue for July 4th in the United States. Will your city be able to at least give 80% of people over the age of 16 one vaccine by June 20th? And if so, will you change the protocols in terms of reopening if that happens?
Well, I think the vaccine and the administration of the vaccines are key to, based on the success we've had, say, in long-term care and other places, it would appear they really are the key to having a reopening of a whole bunch of things. So again, all I can say to you is that the success of the vaccination program is tied to the supply and the reliability of supply.
Right.
And it seems our country has enough contracts and so on to be able to have lots of supply. Then it relates to our ability to get those needles in arms, which I think we can do. And so I'm an optimist about these things, but look, we're doing this as fast as we can, as fast as possible, meaning the reopening part. We'll do the vaccinations the same way. If we have to accelerate that, we'll certainly make best efforts to accelerate that as much as we can. But there are a number of kind of conditions that have to be met, including the behavior of the virus, which has proved to be the most unpredictable thing so far of all. But I'm an optimist about these things, and I think things will be much better in the summer than they are now. But for now, we have to continue to be cautious. I think that's just, it's difficult because it makes you unpopular in certain quarters and there are people suffering great sacrifice.
Yeah.
But I think it's the right thing to do to prevent the ultimate worst scenario, which is another lockdown.
All right, I got to leave it there. Mayor of Toronto, Mayor John Tory, thanks for joining us.